Hello everyone, I am Dr. Anupama Chowdhry Devgan, your Physiology faculty. This is the daily quiz series in the run-up to NEETPG 2025. This is week 5, day 6, and in this week I'm tackling endocrinology and some miscellaneous high-yield topics. So let's have a look at the first question. It says, increased adrenocorticotrophic hormone secretion would be expected in which of the following? Patients with primary adrenocortical hyperplasia. In patients with primary adrenocortical hyperplasia, there is increased secretion of glucocorticoids. And this in turn will have a negative feedback effect on the secretion of ACTH, and it will reduce the ACTH secretion. So, in patients with primary adrenocortical hyperplasia, I expect the ACTH to reduce. In patients with chronic adrenal insufficiency, in an adrenal insufficiency with low levels of the adrenocortical hormones, these will cause an increased ACTH secretion. Patients receiving glucocorticoids for immunosuppression by negative feedback will reduce ACTH secretion. Patients with elevated levels of angiotensin II will cause a decrease in renin, again by a negative feedback, and decrease in aldosterone. So my answer to this question becomes B. Patients with chronic adrenal insufficiency will show high levels of ACTH. Which of the following changes occurs during strenuous exercise? Systemic arterial PO2 decreases to about 70. How much is normal PO2? This is 95 millimeters of mercury. Now please remember that during strenuous exercise there is an increased oxygen demand, there is increased oxygen consumption, there is increased production of carbon dioxide. But there is no significant change in the arterial PO2 or the CO2 levels. Why does that not occur? This is because during exercise there is increase in ventilation. There is increase in the cardiovascular response. There is increase in cardiac output. So even though oxygen consumption has increased, CO2 production has increased, but the PO2 and the CO2 levels in the systemic arteries remains more or less unchanged. So A is not correct. Ventilation rate and oxygen consumption increases to the same extent. This is true. As the demand for oxygen increases, ventilation will also increase. There is increase in the rate as well as the depth of ventilation. Now, please remember, what are the receptors which are getting excited? Which receptors are getting excited, resulting in an increased ventilatory response? It is the joint proprioceptors. During exercise, joint proprioceptor stimulation, this is what is responsible for excitation of the vasomotor center as well as the respiratory center. This will stimulate both the respiratory as well as the vasomotor center, and there is increase in the ventilation as well as increase in the cardiovascular response. This also has been asked as a question. Stimulation of which receptors is responsible for the increased ventilatory response during exercise? Your answer should be joint proprioceptors. Systemic venous PCO2 decreases to about 20. No, it does not decrease. Like I said, in exercise, it remains more or less normal. Pulmonary blood flow decreases? No, in fact, it increases. The cardiac output increases during exercise. So both the systemic and the pulmonary blood flow will increase during exercise. So answer to this question is B. Which of the following will occur as a result of residing at high altitude? Now, high altitude would mean which type of hypoxia? This is hypoxic hypoxia. The characteristic features of hypoxic hypoxia are a decrease in PO2 and a decrease in saturation. Whenever there is a decrease in PO2, it will stimulate the peripheral chemoreceptors. Which are the peripheral chemoreceptors? carotid and aortic bodies, and this causes an increase in the rate and increase in the depth of ventilation. That means there is an increase in the total ventilation and increase in the alveolar ventilation, which is known as hyperventilation. So hypoventilation is not a possibility. In fact, what you see in high altitude is a hyperventilation. Is it a decreased 2,3 BPG? Now, because of the hypoxia in high altitude, there is an increased glycolysis. And increased glycolysis will increase the 2,3 BPG. 2,3 BPG is a byproduct of the glycolytic pathway. So we expect this to increase. Shift of the oxygen hemoglobin dissociation curve to the right, that's true. An increase in 2,3 BPG will cause a shift of the oxygen hemoglobin dissociation curve to right. Pulmonary vasodilation? No, we expect a vasoconstriction. A decrease in PO2 causes a pulmonary vasoconstriction. Please remember, hypoxia is a very potent stimulus for dilatation. It causes, in fact, dilatation in all blood vessels except the blood vessels of the lung, where it produces a vasoconstriction. So answer to this is C. A 55-year-old man has developed SIADH, syndrome of inappropriate secretion of ADH due to carcinoma of the lung. Which of the following responses would be expected in this patient? Now, SIADH means now there is, let's look at the next question. 55-year-old man has developed SIADH due to carcinoma of the lung. Which of the following responses would be expected in this patient? SIADH means there are very high levels of ADH. And what is the role of ADH? ADH increases the water reabsorption in the collecting duct. So more water enters into the plasma, and what is going to happen to the urine? Urine gets concentrated. So is there going to be increase in plasma osmolality? Now more water comes from the collecting duct into the plasma, and in fact it lowers the plasma osmolality. Is there going to be an increased thirst? Thirst increases if the plasma osmolality is high. Here the plasma osmolality is low, so there is a decreased thirst. Inappropriately low urine osmolality? No, in fact, the urine osmolality is going to be high. It's going to be a concentrated urine. Hyponatremia? Yes, there will be a dilutional hyponatremia because there is more water absorption from the collecting duct. This water produces a dilutional effect in the plasma and causes a dilutional hyponatremia. The graph shows the hormonal changes during the menstrual cycle. Which of the following is the cause of the sudden increase shown by B? Here, B is LH, C is FSH, A is estrogen, and D is progesterone. Increase in LH, sudden increase in LH, which occurs just before ovulation. This is because of a positive feedback effect of estrogen on LH secretion. Estrogen increases LH, which increases estrogen, which in turn increases LH. So there's a sharp increase in LH secretion, which is also known as LH surge. And we also know that without the LH surge, there is no ovulation. LH surge is mandatory for ovulation to happen. In fact, just before ovulation, even the FSH level shows a slight increase. Why do I say that A is estrogen and B is progesterone? Estrogen will increase in the pre-ovulatory or the proliferative phase. It also shows a slight increase in the post-ovulatory or the secretory phase, but progesterone definitely increases only in the post-ovulatory or secretory, or what is also known as the luteal phase. So A is estrogen, B is LH, C is FSH, and D is progesterone. And my answer to this question is D.